Great. Welcome everybody to our webinar today. We're really happy that you have chosen to spend your time with us for this really special occasion that we want to mark. We hope to be able to provide you with some information that we feel needs celebration, not just because of the folks that have joined us today and the work that you've done to serve our community, but because of many of the faces that we share on this slide. And many other faces that we don't have pictured here, folks that are our elders that have laid the foundation for the work that we're doing today in terms of advocating for the data for our community. My name is Alice Tulu, and I'm in this role today as a co-lead for the Southern California Pacific Islander Community Response Team, as well as the board chair for the Native Hawaiian and Pacific Islander Alliance, in helping to support this convening. We titled our webinar today, Stirring Up Still Waters, to pay legacy to the work that our elders had done in not settling for the status quo, but for stirring up good trouble to advocate for the needs of our community. And it is upon that legacy that we continue to build our work today. And in terms of this specific topic of advocating for our disaggregated data and representation in federal data, we're happy to be sharing this space with you today. I want to pay acknowledgement to the sacred lands that each of us are upon and do our work upon, and the original stewards of those lands. We recognize that many of us are settlers on the continental US, and are committed in our work to uplifting in our work, our community, but also the rights of Indigenous people whose land we're on. Also want to pay my respects to so many of our elders who have laid the path for many of us. Some of them are here with us today, and if they're not in the room just yet, I want to pay my respects to June Powesi, who I saw in the registration, also Auntie Jane Ka'alapang, who represent so many more who have done the work before us. I want to pay my respects to so many of you who carry our community on your shoulders, and for many of our young leaders that are here that will continue this work. May this gathering continue to pour into the community and the work that each of you are doing every day. And with that, I would like to introduce our pastor, Reverend Mark Kato Onion, who is with the Marshallese community, and who will be providing our opening blessing today. So Pastor Mark, would you like to please come off mute?
Thank you. Is everyone hear my voice?
Yes.
Okay. Okay, thank you. I'm going to lead us a short prayer in our mother tongue. Let us pray. Thank you for the wonderful days that you give us. Kumolgan meurum ejmur, kumolgan kajurum charamman embenodam jej. Chonin occasion ilgun aur Mogadajana mon man lagot kamgana ligde man kachida kancharam manewam kacharam man yenin nan melelego kumna rojagi chandreder reina milo pelagan margunisha rain retelegam molgan opportunity imarun join ngan rojagi melelegen raur ngan kabiju gunenegina kacharam man yenin kacharam man oleban rain rar po bato join meeting in ilo yenin Parchuanalen am charamman chenjinon ngan chamolagun yenin en poengan kumujawol kumolgan rolok moda kenjarabalago ka boy wen go rar kumani em kameng rainin emiyon mal lokagi kamololeukan yenin emman elab dada kan aurgan yenin kejarammane parchuanalen chenjinon ngan chamolagun. In Jesus' name I pray. Amen.
Amen. Thank you so much, Pastor Mark.
Thank you, Pastor Mark, for that beautiful blessing. Up next, we are really excited to have this prominent speaker. He is somebody that is counseling and mentoring many of us growing in the work because he was one of the leaders that was around when our elders first started working on data advocacy. He is the executive counselor for the Asian Pacific Islander American Health Forum, advising them anything that has to do with Pacific Islander health. I want to give a warm welcome to Dr. Kamana'o Pono Crab as our keynote speaker.
Mahalo is. Dilina ke aloha ki akakua pau e na hoa makamaka o te ao. Mai ke kai lipo lipo o ka moana no hoi a hiki ka aina mamau I ka moku honu ma laila no ke aloha no aloha mai aloha kako e aloha. I want to first thank Alisi, Calvin, and all of the organizers for the opportunity to share with all of you. It's great to see you. I'm still getting used to being called the elder. I think I can accept my white hair, but being an elder is kind of moving into it. I see Tao, good to see Auntie Jane Pang joining us as well, and many others. I want to first start off my comments is, and I know the theme for this is stirring up still waters, and the Olelo no Iao that Calvin had selected for this seminar today, which I think is very appropriate. But I wanted to share this Olelo no Iao. O kana au po ke kumu no ka ino. Hello? I wanted to share this olelo no iao. Oia kana au po ke kumu no ka ino. It is ignorance that is the culprit of oppression. Oia ka paio ana I kana au wao no ka ea o ka aina. But it is vigilance that is the liberator to our freedom or our sovereignty as Pacific Island peoples. And the reason why I share that is, knowledge is power, but also in the age in which we live in now, data is also power. And when we are collective as a whole, as Native Hawaiian Pacific Islanders, it's even more powerful when we can consolidate and collaborate together. And so that's why I applaud the organizers for today's seminar and the continuation to be vigilant about the new standards that recently came out regarding OMB 15, particularly to our community of Native Hawaiian Pacific Islanders. But just to share some brief comments about the historical context, and as Alicia had shared, acknowledging many elders that came before us. In the early 90s, I had entered graduate school at the University of Hawaii in clinical psychology and had the opportunity on a number of occasions with the help of people like Hardy Spoor, who was the executive director for Papololokai, to participate in gatherings of Native Hawaiian Pacific Islanders in DC and in other communities throughout the continent. And there was one particular one, and it was in 1997 or 1998, right around of the OMB 15.
I need to know about that though, to be real. Oh.
Yeah, in 1997, regarding the OMB 15 categorization of NHPIs. And it was the first time that Native Hawaiian Pacific Islanders had been invited to a large gathering of the coming together of the Asian community as well as NHPIs. But we probably there was close to maybe 2,000 people throughout the continent, and Native Hawaiians, Pacific Islanders, we probably totaled at the max maybe like 50 people out of 2,000. And so the reason why I shared that is because it was for me, it was one of the beginnings of us coming together on how we will assert our voice as Native Hawaiian Pacific Islanders to be represented on a national scale. And it was also the first time in which I saw collaboration between Hawaii, other community organizations on the continent, and then with policy and advocates from Washington, D.C. And at that time, I recall the importance of being represented in the census for our people. And at that time, we had elders like Kekuni Blaisdell, Eni Faleomavenga, Dr. I think her name was Ala Ilima. She was a physician at Waimanalo Community Health Center, and others from the community that really felt the importance of not just being represented in the census and classification of who we are as NHPI, but in discussions, it was really about acknowledging ourselves as people from our homeland here in the broader Oceania, because I think we all can identify with the challenges of assimilating into the U.S. sort of lifestyle. And I think at the time, we were very cognizant of trying to represent ourselves as Native Hawaiian Pacific Islanders, and the pride that we bring to the table of our cultural identity, our own homeland identity, which was very, very important, and a path for us to perpetuate that as we are part of the broader U.S. system. The discussions at that time regarding OMB 15 was really about highlighting the challenges and the greater need for our people and community based on the data. Because at the local level, in the discussions we were having, we really started to understand the challenges in terms of chronic diseases, behavioral health risk factors, and the other host of psychosocial problems we were experiencing. And later, we became very familiar with the social determinants of health model, because I think many of us identified with that in terms of either we migrated to the U.S. or as Pacific Islanders, our challenges of assimilating into the broader U.S. Culture. And I think social determinants of health was a nice way of showing our challenges or exhibiting our challenges, but it really pinpointed through data where a lot of the need was in terms of cardiovascular, heart disease, diabetes, obesity, and some of the psychosocial challenges that we were experiencing in terms of alcohol, substance abuse, and others. So I think what is important to understand, that data helps to educate and enlighten us about our reality. But the truth is that it should be, and data should be about us elevating who we are and striving for greater equity and well-being within the broader context of the U.S. Framework. I think also OMB 15 allows the opportunity for each group of Pacific Islanders and Native Hawaiians to continue to assert the history and the political status and relationship of our peoples with the U.S. I really want to acknowledge finally the U.S. acknowledgement of the Kofa communities, and finally they through the passage of the recent legislation finally get to provided the resources for their community given the trauma they experienced all these years. And I really I'm really happy about that occurrence. But what it does is it does allow for representation for our people on a political level to establish that with the U.S. and work it through the system for some degree of justice and equity. And that's really what I think OMB really strives for in terms of our people, the opportunity not to just be part of the U.S. system, but actually to exercise opportunity for potential access to resources to improve our people, our communities, and the well-being throughout the U.S. I do want to say is that the process is not easy. It's a long process and it's a long game that we are in. And it only, for me, highlights the importance of being vigilant about coming together collectively as Native Hawaiian Pacific Islanders from our communities all the way up to the national level of advocating for policy changes that represent our people. And today you hear more from speakers, and particularly from Calvin, who will give an update on the OMB standards. So in closing, what I really want to share is that coming together is really great, like on a seminar like this. And by educating ourselves and understanding our history is a great value of understanding where we need to go and where we need to be in the 21st century as Native Hawaiian Pacific Islanders. This kind of seminar helps us to be aware, and hopefully the greater work ahead of us in terms of data, continued advocacy for data disaggregation, so that we can use that in a beneficial way to improve the well-being of our people. But also I want to leave this thought of the importance of community organizing or coalition building around data disaggregation and policy advocacy at a national level. In the 90s and through the 2000s, many meetings, and I'm sure like Jane and Uncle Kaiwi Pang, Sela Panapasa, Eni Faleomavenga, many others who came before us, we did our best in advocating based on who we knew we could collaborate with. But I think Native Hawaiian Pacific Islanders are maturing with many more who are joining our ranks, that we have an opportunity to work collectively together to combine efforts on data disaggregation and policy advocacy at a national level. So I'm very pleased to see where we're going and the efforts of the organizers for today in terms of the updates for OMB. No laila, mahalo nui aku ia o ko a pau, no ko hapai ana I ke kule ana. Thank you to the organizers and to all of you for your work in advocating on behalf of our people. I hope you have a great day today in listening to the speakers, and let us all work collectively together to elevate our people. Mahalo.
Thank you, Dr. Kavanagh. Pono Crab. Up next, we have our very own Uncle Calvin. He is the care director of the NHPI Data Policy Lab at the UCLA Centers of Health. And as you all know, our very own NHPI data experts.
Mahalo, Isa, and aloha mai kako, and thank you for the opportunity to present. I'd like to first recognize that the work we do would not have been possible without elders like Dr. Crab, Uncle Kaiwi Pang, Auntie Kaala Pang, Kevin Young, June Poesi, or Pat Luce, who really paved the way for a lot of us, especially those in California, to do a lot of this community work. The NHPI Data Policy Lab exists as a resource for Native Hawaiian and Pacific Islander communities seeking to build their capacity to work with data. Our work has included data advocacy, which includes the development of an NHPI data policy platform, the development of data tools to make NHPI data more accessible to our communities, and providing data trainings to our NHPI nonprofits. Next slide, please. Statistical Policy Directive, which in this presentation we'll be referring to as SPD 15, because apparently that's what the federal government wants to refer to it as now instead of OMB 15. It sets out the minimum race and ethnic categories that federal agencies must use when they collect information on race and ethnicity. SPD 15 applies to all federal information collections, and by that, I mean surveys, censuses, and administrative forms. And it was recently revised because OMB recognized that a lot of our country's demographics have really changed since it was last revised in 1997. Next slide. SPD 15 first came about in 1977 as a result of the Civil Rights Movement. And the Civil Rights Act and numerous other pieces of legislation require that the federal government track our race and ethnicity to ensure compliance with civil rights laws. It's important to note that these are minimum categories that federal agencies are supposed to use. More detailed categories could be provided as long as they can roll up into these minimum categories. And in 1977, we were combined with Asians. Next slide, please. Even at this time, in 1977, advocates still recognized the importance of having detailed race categories to represent their communities, and convinced the Census Bureau to use checkboxes in the 1980 census for a number of our detailed groups. I apologize for the blurry photo. That's the best I could find of a form from way back in 1980. Next slide, please. The review process to revise SPD 15 started 4 years prior. Workshops were held, and it was really important to make sure that our communities were disaggregated from Asian Americans. And individuals like Senator Akaka, Esther Kia Aina, and Hardy Spoor played a large role in convincing OMB to override the recommendation from a federal interagency working group that wanted to maintain the status quo of an Asian or Pacific Islander category. And Senator Akaka noted in testimony that a separate category was necessary because of mounting evidence of significant health and education disparities being hidden under the API label. So in 1997, OMB revised it to include a disaggregated Native Hawaiian and other Pacific Islander category as part of the new minimums. agencies were given 5 years to implement the new standards, but unfortunately, many agencies continue to fall short of complying with this 27-year-old directive. And now we reach 2024, and the categories contained within the current revision were first proposed in 2015 as part of the Census Bureau's National Content Test. And what this test essentially revealed was that people were more willing to identify themselves with detailed race categories when provided with a checkbox. And they proposed a format with additional checkboxes that became part of the 2024 revisions, which we'll now get into a bit more detail. Next slide, please. So 2 major changes have caught a lot of attention in the news with these revisions. The first was that race and ethnicity, which were 2 separate questions, have now been combined into one. And you can see on the right-hand side, Hispanic or Latino is now one of those categories under the new combined question. Next slide, please. The second major change is the addition of a Middle Eastern or North African category, which I know many NHPI organizations supported in solidarity. Next slide, please. For our communities, arguably the most monumental change is the revision that adds new default detailed race categories. And this represents the most significant revision for us because it solidifies the importance of disaggregating NHPIs from Asian Americans, and it shines a light on individual NHPI communities that would remain hidden under the NHPI label. And the 6 categories we see here represent the 6 largest NHPI communities in the US as of the 2020 census. It also removes the other Pacific Islander checkbox, which I think a lot of organizations recognize is essentially useless for informing programs and policies. And OMB includes strong language in these revisions that say a write-in box should be provided whenever possible to allow for more communities to self-identify beyond these 6 categories. Next slide, please. And now we'll take a deeper dive into the significance of having these detailed race categories for our communities. Next slide. The 2020 census form on the left showed only 3 specific NHPI communities received the detailed race checkbox. SPD 15's revisions would add the additional 3 checkboxes indicated on the right. So this would represent the first time that the Tongan, Fijian, and Marshallese communities will receive their own checkboxes as part of the default categories for federal agencies. Next slide, please. So these additions represent a 17% increase, nearly 1 in 5, in the number of NHPIs that could have their own checkbox. Next slide, please. And we know that the NHPI community is incredibly diverse. The 2020 census provided population counts for 31 detailed NHPI groups. Next slide, please. Whereas the NHPI label would show all of our communities together lumped under NHPI. Next slide. SPD 15's default categories would allow 1.2 million NHPIs in this country to have their own checkboxes representing their specific NHPI community. And recognizing this diversity is critical. NHPIs, as we know, all have our own distinct language, cultures, and traditions, as well as relationships with the US government that are reflected in various funding streams and varying levels of access to programs and services. Next slide. The 6 largest NHPI communities also continue to grow at a rapid pace, which furthers the need to ensure that they're accurately represented in data. And as you can see, the Marshallese community more than doubled between 2010 and 2020. I'd like to note that the Chamorro category has replaced the Guamanian or Chamorro category as of 2020. Since 2020, the US Census and American Community Survey have been using the Chamorro category. The Guamanian label left the door open to misinterpreting the category to include people who were not Chamorro, but happened to have been born in Guam, when the intent of this category was to represent those having origins in the original peoples of the various Pacific Islands. Next slide, please. Also, a critically important addition to these revisions is OMB's implementation guidance. They make it very clear that multiracial data must be collected and reported. And this does not mean having a catch-all category called multiracial. We believe individuals should be offered the opportunity to select all of the categories that apply to them. And when single race categories are reported, that leaves out many of our communities. And for Native Hawaiians, that means missing out on 71%, nearly 3 in 4 Native Hawaiians when you use a single race category to report. And other communities face similar issues. About half of Samoans and Chamorros would not be counted under a single race category. And more than 1 in 3 Tongans and Fijians would not be included in their data. Next slide, please. So what OMB provides in their implementation guidance are 3 ways in which multiracial data could be reported. The first approach is the alone or in combination approach. And so whenever a person marks any of the boxes, they will be included in all of the categories that they checked off the box for. And this is probably the most inclusive way of reporting our communities and our multiracial members of our communities. Next slide, please. The second approach reports as many possible racial and ethnic combinations as possible, and each combination is mutually exclusive. So if these represented percentages of the total population, it would add up to 100%. Each person would be represented once in the combination of the groups that they selected. Next slide, please. This third approach is where the racial groups are a single race, and then you have the catch-all multiracial group at the bottom. And this is actually discouraged by OMB. Their implementation guidance recommends that this approach should only be used in conjunction with approach 1 or 2 in order to comply with a specific requirement in the revisions to report as much information on race and ethnicity as possible. The revisions do contain an escape hatch for federal agencies. Agencies may apply for an exemption to these default categories. They would be required to first request this exemption from the Office of Information and Regulatory Affairs, also known as OIRA. And we see this agency as a new front in our data advocacy work. This agency falls under the executive branch, and they can either help us or try to prevent a lot of regulations from being implemented, depending on which president is in office and their priorities. When federal agencies propose a process for collecting information, it typically goes through a standard clearing process with a 60-day and 30-day window for public comment. However, the SBD 15 revisions say that federal agencies can submit what's called a non-substantive change request, which is a process that's more behind the curtains and can happen without notifying the public. And I think one of our next steps should be to make sure there's clarification into which process federal agencies have to use. And we would definitely prefer the standard clearance because that provides our communities with more of an opportunity to comment if federal agencies want to exclude our detailed race checkboxes. Next slide, please. And so the revisions also contain illustrative examples of question formats that might be useful for those that are advocating for state and county health agencies to reformat their surveys as well. And the first form is one that we showed earlier. And this contains all the detailed race checkboxes that are in the revisions. Next slide, please. So the second form contains only the minimum categories, no detailed race checkboxes. Agencies have to receive an OIRA exemption in order to use this. Next slide, please. This is technically allowed by the OMB under the new revisions, where even the examples of each category are removed, but OMB is very much discouraging this. They specifically state that agencies should only use this form when it's not feasible to use the other forms. But I also want to note that both this form and the last form still include a disaggregated NHPI category, which a lot of federal agencies still are not implementing. And so even when they request an exemption, a separate disaggregated NHPI category is supposed to exist. Next slide. And I don't want to spend too much time going over some other notable revisions. I do want to point out for California, California has a habit of top coding the Hispanic Latino category. And so only people who are not Hispanic or Latino get filtered down and provided with a racial category. And so that means it's problematic for us because those of us who are both Hispanic or Latino and NHPI would not be counted in the NHPI category. OMB revisions say that can't happen with federal agencies, not anymore. No more top coding. All the categories need to be treated as co-equal. And just to follow up with some important dates, March 28th was when SPD 15 and these revisions were published. All the agencies have 18 months to submit an action plan to implement the new revisions, which brings us to the end of September 2025. And there's a 5-year deadline for all of the agencies to implement this. And there's a periodic review that will occur every 10 years from this point to review the SPD 15 categories to make sure that they are where they need to be. The reviews can happen before then, but at the very least, we shouldn't have to wait 27 years for the next revision. Next slide, please. And we're just listing some of the resources available if folks would like to look up the exact text of some of the language that we quoted here. Next slide, please. Mahalo, and thank you again for the opportunity to present.
Thank you, Calvin, for that beautiful presentation. Up next, we want to introduce our first community speaker, Melanita Fifita. She is a leader in the Tongan community of Orange County. She serves on the board of directors for PIP, Pacific Islander Health Partnership, and co-founded Family Petaha, a Tongan civic club in Orange County, all while working as a staff research associate for the program of public health at the University of California, Irvine. I want to just give a warm welcome to Melanita Fifita. Thank you.
Malo Pito Isa, as the slides are being brought up, I'm humbled to share my experiences in this work, and I'd like to say thank you, Malo Pito, to Calvin and Alisi for reaching out and giving me the opportunity to share my experiences. And I recognize that I stand on the shoulders of giants that have laid the foundation for all of us. And in honoring the sacrifices made by the generations before us to thrive, thus the greatest reward for a job well done by our elders is more work. Next slide, please. So in January of 2010, my mother detected a small lump on her breast. By June of 2010, the lump had grown to the size of a golf ball. She was denied Medi-Cal and did not qualify for SSI because she did not meet the age requirement. She was not yet 65. And so being medically uninsured, we were blessed to know Uncle Kaivi Peng and Auntie Jane Kaala Peng, founders of Pacific Islander Health Partnership. And they had shared their resources and their social networks with us to better navigate for my mother. Pacific Islander Health Partnership is the nonprofit that is composed of 5 NHPI communities, which include the Chamorro community, the Marshallese, the Native Hawaiians, the Samoans, and the Tongans. Talk about the power of partnerships. Next slide, please. So the power of partnerships, those partnerships allowed us to navigate my mother for treatment through the Every Woman Counts program. She received full treatment, fully covered, and now is cancer-free. But through her journey, we considered other Tongan families that have difficulty navigating the healthcare system. And of course, we could not just go on without sharing her story and helping those other families navigate the healthcare system. So we learned from her journey and the many gaps in seeking healthcare access, and we created the Tongan Civic Club called Family Petaha, which is one family. Next slide, please. So there were many barriers that we faced in patient navigation. We recognized that there was a lack of trust. Many did not want to apply for health benefits because of their immigration status and the fear of applying and going into those spaces. And then there's a language barrier. When we finally got the patient into the seats at the health clinics, they had trouble talking to the doctor or understanding the terminology. We also recognized that there was medical costs that it was $20 to see a doctor, in which they most times could afford. And if they could not, then Family Petaha covered the cost. But when it came to testing, because most of them were high blood sugar or diabetic and they were sharing medications, they denied getting the testing because they couldn't afford it. And so we tapped into our social networks, and we had fundraisers and golf tournaments and invited all of our rich friends to come and give us money. But we all know that we can't ask our rich friends all the time. And so we thought of applying for federal funding, but then there was no data for the Tongan community. So how can we apply if we can't show that there's an actual need within our community? Next slide, please. And then COVID happened. The OMB 1997 standards did not collect data for Tongans, and we were dying, but no one was telling us we were dying because there was no data. They told us that the NHPI community during vaccinations were 100% vaccinated. And we knew that that wasn't true because there were people within our own houses that were not vaccinated. And so again, going back to community grassroots level, we tapped into our social networks and social media. We went on Facebook, we pulled the pictures of our faith-based leaders conducting weekly funerals, and we submitted them back. And the county accepted our request to prioritize our faith-based leaders to be protected first. That then opened up the gates for us to better serve our community during the pandemic. Next slide, please. I'd like to shout out community champions, Savani Lee, Dr. Sora Park Tanjasiri, that worked with our communities for decades to address data equity. So in 2020, several advocates started working together around the need for COVID-19 data disaggregation. And Savani rallied a big group of people and many partnerships of 25 plus community, academic, health system organizations, and with the funding coming from the Office of Minority Health to UCI, we created the Pacific Islander Asian American Data Equity Health Policy Collaborative. And we're currently working on the third year of that grant. For the sake of time, we are coming out with a community report in May, and we are hoping that we can utilize the community report as an advocacy tool to help develop and implement the new standards. So next slide, please. And the benefits of these new standards, like I said, we can't ask our rich friends for fundraising all the time, but with data, we can advocate for the needs of our community, and we can apply for those fundings for our community, which then will give us more resources to serve the community. We can also strengthen the partnerships with county and state health departments. And through the strengthening of those partnerships, we can help to develop and implement the new standards. Next slide, please. And so to truly honor the work of our elders, we must continue to build strong relationships and empower the next generation, pouring into them as our elders have poured into us. Our future plans include increasing Native Hawaiian and Pacific Islander advocacy and visibility by maximizing the relationships we have all around us. So together, we honor the sacrifices of the elders to thrive. Next, please. It is my hope that this continues to inspire you in the work that you all are doing, and that together we can continue to work in these spaces. Maloa Pito for allowing me to share.
Thank you, Melanite, for that beautiful presentation. Up next, we have another community speaker all the way from DC, Adam Carbolito. Adam served as the Chief of Staff for Congresswoman Madeline Bordalo from Guam. He is currently the Director of Policy and Advocacy for the Association of Asian Pacific Community Health Organizations, or APCHO. Go ahead, Adam. Thank you.
Yeah, thank you, Isa, and Hafide, and hello, everyone. I also want to start by acknowledging all those who worked tirelessly for NHPI data equity throughout the years. It has been such a historic work that has really led to true change and positive benefits for our communities. And I, like many others, are standing on their shoulders in the work that I do now. I also want to thank SoCal Pickert, the NHPI Data Policy Lab, NIOPO, and the Regional Pacific Islander Task Force for organizing this webinar on the revisions to the federal guidelines on collecting and reporting race and ethnicity data. As Isa mentioned, I'm Adam Carbolito. I'm the Director of Policy and Advocacy with the Association of Asian Pacific Community Health Organizations, or APCHO, for those of you who may be unfamiliar with our organization. APCHO is a national nonprofit association of community-based healthcare provider organizations, mainly community health centers, that works to improve health access and outcomes for medically underserved Asian Americans, Native Hawaiians, and Pacific Islanders in the United States, the U.S. territories, as well as the freely associated states. And data disaggregation, data equity has long been a priority for APCHO and our member community health centers and partners. And we're very excited by the progress that OMB has taken to update the minimum standards. And I want to underscore that what OMB is doing, these are the minimum standards that the federal agencies will collect and report on race and ethnicity across government programs. And this truly is a historic update, and we're really looking forward to the agencies implementing them. From my perspective, from APCHO and an organization that represents mostly healthcare provider entities, as well as a broad array of community-based organizations, I think there's three areas where these new data standards will have the most important benefit for NHPI communities. And while I'm mostly going to be focused on the standards' importance in healthcare, they really are applicable in all the other sectors as well. I know that Kamana'o mentioned, the advocacy on uplifting the social determinants of health, and that's really every other aspect that goes into an individual's health. And we know that they will make an important progress in advocacy in addressing SDOH issues. First, I think the new standards will have a direct positive impact directly in a healthcare setting. It's positive that OMB is requiring agencies to collect 6 Native Hawaiian and Pacific Islander subgroups, as well as requiring the write-in option unless the agencies get an exemption, which we are hoping will be a very difficult process. We know that NHPI communities are not a monolith, and the most important and the most effective way to provide care to patients is to address their needs in a way that is culturally and linguistically responsive. While many of our communities share many of the same values, we come from different islands in the Pacific, each with our own unique culture, language, heritage, history, and frankly, experience with the US healthcare system, which is often very different from the systems in some of the Pacific Island countries that many of us originate from. Understanding a patient's race plays an important role for healthcare providers to provide the most effective and efficient care, both in understanding a patient's predisposition and risk factors for diseases, as well as tailoring interventions that meets a patient where they are. A one-size-fit-all treatment model is not acceptable, and having disaggregated race data will help providers better provide care to their patients. And many of APCHO's member community health centers really do understand that when you target care specifically for a patient that meets their cultural and linguistic needs, it really does provide better health outcomes. And we are hoping that as more government entities and more healthcare providers are being required to collect disaggregated race and ethnicity, that'll really mean better health outcomes for NHPI communities as well. Second, these new requirements, I hope, will lead to better and more inclusion and more consistent inclusion and understanding of how certain diseases specifically affect NHPI communities. Far too often, research and data completely leaves out NHPI experiences, or it aggregates our communities into a broad API or similar category. This really makes our experiences invisible. And we often hear from agencies that they're only following what OMB requires. So now that they have new standards that disaggregates data, we'll be working to hold the agencies accountable to their obligations to include detailed information on Native Hawaiians and Pacific Islander communities. And I also hope that this will include consistent reporting from the US territories, which is often completely excluded from federal reports. And being a former congressional staffer from the Guam for the Guam delegate to the House, we know how challenging it is for us to get resources for our communities, not just in the territories, but for NHPI communities throughout the country, without data that that backs up the requests and that really demonstrates what the community needs are. And lastly, I think this dovetails is we hope that having detailed data will be important for for advocacy to ensure that NHPI communities' needs are being addressed in all sectors and all programs offered by the federal government, and by extension, state, local governments, as well as the private and nonprofit sectors. We hope that we can use this information to ensure that federal resources are reaching our communities, and that our experiences and needs are not invisible when decisions are being made. It was mentioned earlier, the challenges during COVID, and we learned from the pandemic that having disaggregated race and ethnicity data can literally save lives. And many of the organizations on this call and who worked with the partners, our partners, played a critical role in pushing the CDC, HHS, and state governments to report out NHPI data, because when they did, we saw that NHPIs were either the most or among the most impacted communities. And when we had that data, we were able to target resources to help our people. And again, it literally saved lives and made it so that our community's needs were addressed, on the spot. And again, earlier, Dr. Crabb mentioned the passage of eligibility for COFA citizens living in the United States to apply for federal benefits. And that advocacy and the work that many of the organizations in this room, many of the COFA advocates presented to lawmakers was largely made possible because of the persistent advocacy that used disaggregated data from our brothers and sisters in from the freely associated states in pushing those policymakers on what it would mean for their constituents in their districts and their states. And I was in many Hill visits where we were demonstrating to members of Congress and US senators the numbers of COFA citizens living in their states and how they were being completely excluded from these benefit programs. And in order for them to improve quality of life and make sure that they were accessing programs that would help them thrive, it really made all the difference. And it was able to leveraging that data, that detailed data on the Marshallese community, the Palauan community, the Chukis, the Kosraean, the Yapis communities, in demonstrating that there were large pockets of COFA citizens living in various states across the country, and using that data, that detailed data in advocacy, made a whole host of difference in persuading members of Congress and senators to get on board with this legislation. So we know that these revisions are an important step in the work for equity for NHPI communities. I do hope that we can all celebrate the milestone in getting OMB to revise them. It's been 27 years since the last revision, and it's been a long time coming. And we should all again give gratitude to the many individuals and organizations who led the way to get us to where we are today. But there is still a lot of work to be done to ensure that our communities are meaningfully included in federal reporting. Calvin mentioned some of the timeline that OMB has given to the agencies for an implementation plan. They must have an implementation plan developed within the next 18 months and full implementation by 2029. You can rest assured APCHA will be a committed partner in working with our community leaders to ensure that these plans take into account the needs and experiences of NHPI populations. And we will be sure to hold federal, state, and local governments accountable to implementing them in ways that meets the true needs of our communities. So again, Sidzos Masi to the organizers of this event, Sidzos Masi to everyone who got us to today, and thank you for everyone who's here today, and looking forward to working with each of you. Thank you.
Thank you, Adam. For the sake of time mentioned in the chat, we'll be skipping Q&A today, but feel free to send your questions to me or Calvin. Up next, we'll just move on to our closing. I am pleased to introduce our only NHPI commissioner on the API Governor Commission. She co-founded and is co-director of the first Bay Area Regional Pacific Islander Taskforce. I'm welcoming Taunu'u Ve'e. Thank you.
Malo soifua for the sake of time. So I have to listen to instructions here and be quick about it. See the smile on Alisi. So anyway, first of all, traditionally, I want to give much thanks to all of the speakers before me. And you've done a tremendous job in really laying out the legwork, and as Adam said, to be continue the implementation and of all of these efforts. So congratulations. I wanted to say this is so fitting, the theme in stirring up still waters. When Alisi said that to me, the first photo I remembered is like, oh, I remember those crossing the Bay Area, the Oakland Bay. My gosh, can't even say the bridge in San Francisco, and we were there to witness the crossing of that. And that reminds me of our people, the self-determination and resilience, and with no matter what policies that's put upon us, and all of everything that is decided, the missing of data, and then started out with others. And I remember Sela, we're not dash dots and dot, and quotation marks or what have you, but we've come a long way. We've journeyed a long way together. And so all I can say is we have a lot of our young people that are looking to some of us that have come before, but never forget to thank those that have been before us, the shoulders that we stand on, and paying much respect for them. And that's, the metaphor of having all of the journeys going through those canoes. That's all of us still journeying those canoes in really rough waters at this time. So the journey begins, and I want to just say, with all of us, I'm in spaces like the UCSF Helen Diller Cancer Center as an advisory board, also board for the CPAN, the California Pan Ethnic Health Network, and of course the California Commissioner for Asian Pacific Islander. We had no voice in these spaces, and these spaces have a lot of influence in policies and whatnot. Now we have a voice, and thank you to all of you, who have backed us up for everything that we have done. So as time is of the essence, we're so bad at this, but anyway, that's okay. But I like to end with, I'm told that I have to do the blessings. So let us bow our heads, and I will do the blessing. Lo mato tamapa iai. Olo walofa sili ese o mawalunga lava lo wafio. Vi ia lava la wa fio le tua le tama. Patai lava lo pata si mai. Patai lava ye ua whaasoa mai a wale. Le lumana i o mātou tangata le atua le tama. Ia e whata si mai. Fo i mai lava le. I lo mana ma lo alofa tu noa. E taita ina mātou le atua. Ia e fo i mai fo i. Le loto. Le mātou loto mawalalo. Ina ia taunu upea le mātou wha moe moe. I le whaftai atu fo i. Ie taita ina le nei wha moe moe manuia. Dear Lord, thank you so much for making your presence known to us throughout the whole webinar. Thank you to Alisi, Calvin, and Isa for leading the preparation, for all the hosted organization, dear Lord. Thank you to our Pacific Islander community. We love them and keep us near. And we lead with love, dear Lord, but continue to guide us and navigate us to further waters and knowledge, and to all of our research, bless them all. And I say all of these things in your holy name. Amen.
Amen. Thank you so much, Tal. And thank you everybody for being here, and a great reminder to continue to store up the still waters in your neighborhoods, in your counties, in your states, and let's continue to advocate good things for our community. Have a great rest of your day and happy April.